Hi, my name is Maria Chiu. I am a PhD student at Northeastern University and a researcher in the Orthopedics Department at Massachusetts General Hospital. On behalf of my co-authors, Dr. Elina Tochilnikova and Dr. Casper Harteveld, also of Northeastern University, I would like to present our paper, From Novelty to Clinical Practice, Exploring VR Exergames with Physical Therapists. Physical therapy is a hands-on form of rehabilitation that uses repetitive movement and physical exercise to recover and improve strength, mobility, flexibility, and daily functionality. Because of the hands-on nature of the practice, technology has not played a significant role in this field. However, the rapid development of immersive technology such as virtual reality has created opportunities for more innovation implementation in the field of PT. Our motivation for this study originates from a desire to take advantage of this push for innovation to test the integration of VR into evidence-based clinical practice. Our study was guided by two research questions. What aspects of existing VR exergames are useful to clinical rehabilitation, and what features do physical therapists want to see in future VR exergames that would significantly benefit their work and their patients' rehabilitation? Major challenges of integrating technology into PT practice include the following. All medical fields, including physical therapy, require substantial evidence of efficacy and safety before change can occur. Even after evidence of clinical value is determined, it takes time to be translated to the clinical environment. Technology is often too expensive and grows too quickly to be effectively integrated into PT practice. Insurance companies won't reimburse for experimental treatment that hasn't been compared against established remedies. There is fast-growing interest in the research field in VR as an intervention for multiple specialties of physical therapy, most commonly neurological rehabilitation for stroke and Parkinson's patients, and for management of pain and vestibular symptoms such as vertigo and balance loss. For the purposes of our study, we chose to look specifically at VR exercise games, or exergames for short. An exergame is a game that utilizes exercise principles with the objective of supporting physical activity. VR exergames that have already been evaluated as rehabilitation interventions include FitXR, HoloFit, and VZFit, all available on the MetaQuest platform. We chose as our probe Supernatural VR, a robust exercise game also available on the MetaQuest platform that, at the time of this study, had not been used in prior research. Supernatural features accessibility options, a large music library, varying levels of intensity, and 4 exercise modalities, respectively flow, boxing, stretch, and meditation. All of our participants played in the flow mode, in which the player uses virtual batons to strike at incoming targets, choreographed to the beat and pace of the music. Additional movements include squatting, lunging side to side, and knee strikes for a well-rounded full-body workout. We recruited 8 physical therapists for our study, 4 male and 4 female, with an average of 6.75 years of experience. Participants first conducted a playtest of Supernatural VR. As mentioned, all 8 chose to play in flow mode. Playtests ran for 10 to 15 minutes. Following this, we engaged in a short debrief of the game, including asking the participants about their levels of enjoyment, challenge, and distraction. Then we moved into a semi-structured interview. We questioned the participants about their current use of technology, experience with games and VR, how games could aid traditional PT practice, and the potential benefits of VR. We also asked them to speculate about the future of PT and how developing technology plays a role, as well as barriers to innovation. Many common themes arose from the participant responses. In terms of the advantages and potential benefits VR exergames can provide for PT practice, participants touched on the controlled, diverse environments that provide immersion and distraction. The competitive nature of games can also be complementary to progress in rehabilitation. Games often feature progress tracking and data logs that can show improvement over time. Physical therapy is often repetitive and monotonous, and games provide additional motivation to stay compliant to rehabilitation protocols and home exercise programs. Finally, the ability to customize the intensity and difficulty, as well as options to make the game more accessible to special needs, are both key advantages that can greatly benefit PT practice. Regarding Supernatural specifically, participants shared the biggest pros and cons that they saw from their expert perspective. The game allows for more extension of functional range of motion, but is not good for anyone recovering from an acute injury or who has movement limitations and restrictions. The game can be a great confidence booster in ability, but that can also backfire because there is no targeted form correction. The game provides a good cardio workout, but it would be difficult to build strength without weights or resistance. The game has a low barrier of entry, which makes it more accessible, but also lacks specificity for rehabilitation use, which makes it less useful for patients with very specific PT needs. The game tracks and records results, but more from a game completion aspect, with no outcome measurements that are actually useful for PT. The mental benefits of a game like Supernatural, and of VR technology as a whole, were agreed by all participants to be far greater than any physical benefits. The physical therapists in this study agreed that VR has the ability to stimulate cognitive improvement, which is in line with previous research assessing other VR technologies and games. These improvements include perception of a task, response time, and subconscious movement. As mentioned previously, VR can boost both confidence and motivation. One participant described VR use as a good tool for neurological rewiring, which entails increasing the growth of healthy, form-correct muscle memory and decreasing physiological response to trauma and the fear of re-injury. In the future, with more integration into clinical practice, VR can become an effective tool for working on strength and conditioning. One participant emphasized the importance of preventative care and PT's role in creating a healthier population and offering non-surgical treatment options for a variety of pathologies. VR can help spread that awareness and boost education in this area for both patients and clinicians. VR can increase a patient's autonomy and control of their own journey of recovery, which can lead to better outcomes. It can help decrease the amount of time clinicians spend on non-therapy tasks like documentation and improve their efficiency. VR can become a new method of delivering care, alleviating some of the barriers of access that patients can experience due to socioeconomic, financial, time-related reasons, or physical disability. This study contributes domain expert perspectives on the road to turning immersive technology such as VR from a novelty piece of technology into a recognized and accepted clinical tool. For future studies, we will seek to combine other technologies like biosensors, motion capture, and full-body haptic feedback with VR to build more robust systems for rehabilitation use. As more immersive technology becomes available, telehealth will see a transformation into virtual and immersive healthcare modalities. We would like to stress that as this transformation happens, it will be important to continue the interdisciplinary conversations between designers, developers, and medical experts, so as to leverage the best expertise of all fields in generating new ideas. Thank you so much, and we hope you'll check out our full paper for more information.